So botulinum toxin helps to reduce the wrinkles by reducing the movement. An example of this would be in the frown, so if somebody's making the scowling movement, then the muscles come together and cause a crease in the centre of the face. Quite often people think that they've had too much if their friend maybe has had Spocky eyebrows where their eyebrows go up, but actually it just means you've had too little. So we try to ensure that you have the correct dose to start with, but of course unless we get to know you, it's impossible for us to know exactly the correct dose. What we always say is come back 2 weeks later and you'd have an additional dose which is included in the price of the treatment. If somebody is concerned about lines but they're not there when their face is resting, so their face is relaxed, if the line's not there then they don't have to worry about it. So it's really for people who have lines that are there either at rest or that they're not happy about maybe the indentations that they're causing when they are making the movement. Can be painful if you don't have an anaesthetic cream on, although I would say the sensation is almost a millisecond of an injection through the surface of the skin. Most people say that they're not bothered about it. Once they realise and they've had the treatment before, they can appreciate how it feels. Well, we allocate an hour if you're a new customer, half an hour if you're an existing customer, but the treatment itself probably only takes 5 to 10 minutes. A lot of it is making sure that we draw up everything for the right dose according to the customer, that everything's okay with your medical history and that people have their anaesthetic cream applied. Oh, there's a few things that can go wrong, but common side effects that we expect to happen. So possibly a little bit of itching, tenderness, swelling, bruising can happen, although it's rare, so it's important for you to think about these things in terms of, do you need to hide it from somebody, which is quite common, or if you want to cover your bruising, do you have the right makeup at home? But all of those are normal. Things that we don't want to happen would be an infection or a risk of an eyelid or an eyebrow droop. So basically the drug affects the muscles and how the muscles move. What we don't want is for it to affect a different muscle and for the other muscle that we don't want to affect to not move. So for example, we want the eyelids to open and close, but if we affect the eyelid, then it could stay closed in an unwanted kind of way. The important things to look for are having a consultation, making sure that the practitioners can be there for you if you have any side effects. Ask the practitioners what they would do if these side effects were to happen. But just to, of course, botulinum toxin is a prescription drug, so it's really important that you know that the practitioner or their prescriber is a registered practitioner who can prescribe the drug for you.